All right, let's dive right in. Today, we're going to pull back the curtain on Parkinson's disease. We're going to break down what it is, how it shows up, and maybe, most importantly, why spotting its unique pattern is absolutely critical.
So, to really get Parkinson's, you have to start with a single, really important question. What happens when the brain's primary messenger for movement just disappears? That question right there is the key to understanding the whole thing.
And the answer to that question? Well, it all comes down to a chemical you've probably heard of, dopamine. Everything, and I mean everything, we're about to talk about stems from the brain not having enough of this one thing.
So, what is Parkinson's? Officially, it's what's called a progressive neurodegenerative disorder. That's a mouthful, but it just means it's a condition that affects the brain and sadly gets worse over time. And it's all caused by the loss of brain cells that make dopamine. These cells live in a tiny part of the brain called the substantia nigra. The best way to think about it is like a little dopamine factory in your head, and in Parkinson's, that factory is slowly, quietly shutting down production.
You know, if you only remember one thing from this, let it be this simple equation. Dopamine equals smooth movement. It's like the oil in an engine. When you have plenty of it, all the parts move effortlessly. But when you start running low on that oil, things start to get stiff, slow, and jerky. That's Parkinson's in a nutshell.
Okay, so we know the dopamine factory is having problems. But what does that actually look like in a person? How does it show up? Well, it usually appears as 4 core symptoms that really paint the classic picture of the disease. These are the big 4, the cardinal features. There's even a handy acronym to help remember them. TRAP. T for tremor, R for rigidity, A for akinesia, which is really just a fancy word for slowness, so we'll call it bradykinesia, and P for postural instability. Let's quickly break each one down. First up, the tremor. And this isn't just any old shake. It's really specific. It's often called a pill-rolling tremor because it looks like a person is rolling a little pill between their thumb and index finger. The other key thing, it's a resting tremor. That means it's most obvious when the hand is just resting in their lap, and it often gets better when they go to do something. And one more huge clue, it almost always starts on just one side of the body. Next, we have rigidity. This is a special kind of stiffness in the arms, legs, or even the torso. When a doctor moves a patient's arm, it can feel one of 2 ways. Sometimes it's a smooth, steady resistance, kind of like trying to bend a lead pipe. Other times it's this jerky, clicking resistance. We call that cogwheel rigidity. And the stiffness, this is often what causes a lot of the aches and pains in Parkinson's. Now this third one, bradykinesia, sounds complicated, but it just means slowness of movement. But it's more than just being in slow motion. It's about having a hard time starting a movement in the first place. You'll see people have real trouble just getting up from a chair. And it's what leads to that classic shuffling walk with tiny little steps, because initiating each and every step is a real struggle. And the last of the big 4 is postural instability. Really, this is all about balance. The first 3 symptoms can show up pretty early, but this one tends to come a bit later. And it is a huge deal because, as you can imagine, poor balance means a much, much higher risk of falling. But here's the thing. The story doesn't end with those 4 motor symptoms, not even close. The effects of that dopamine shortage are felt all over the body. So let's look at some of the other signs that really fill out the picture.
Think about all the little automatic things our bodies do without us thinking. With less dopamine, those things start to fade. You get what's called masked facies, where the face loses its spontaneous expression. It can look like a mask. The voice can become very soft, very flat, and even handwriting changes. It often gets smaller and smaller as someone writes. We call that micrographia. And of course, a stooped, hunched-over posture is really common too.
And then there are the symptoms you can't see. The invisible, non-motor symptoms. And honestly, these can be just as bad, if not worse, than the movement problems. We're talking about things like chronic constipation, really disruptive sleep problems, and a very high rate of depression. These have a massive impact on someone's quality of life. So we've talked about the cause and this whole collection of symptoms. But so what? Why does putting all these puzzle pieces together, recognizing the full pattern, matter so much? Especially when things get serious. Because here's the reality. A person with Parkinson's might not show up to the ER because of their tremor. They might show up because they had a bad fall. Or they could be incredibly stiff and frozen simply because they missed a single dose of their medicine. They could be having trouble swallowing, which is a choking risk, or getting dizzy and passing out from sudden drops in their blood pressure. If you don't recognize the underlying pattern of Parkinson's, you can't treat these emergencies the right way. And this right here is the challenge. In a chaotic, high-pressure situation, the slowness, the stiffness, the balance problems, they can look a lot like other things. Is that person having a stroke? Are they intoxicated? Are they just weak from some other illness? The only way to tell the difference is to spot that unique combination of signs. So really, it all boils down to this. Recognizing the pattern, that specific mix of resting tremor, rigidity, and slowness, is what gives you the power to differentiate. It lets you separate Parkinson's from all the things that can mimic it, so you can give the right kind of help. It's about seeing the whole forest, not just one tree. At the end of the day, just being able to spot these signs is the crucial first step. It leads to empathy, to better care, and hopefully to a correct diagnosis. But of course, that just leads to the next big question. Once you see the pattern, what on earth do you do next? Thank you for joining me for this explainer.